I don't want to make it public. Let's do private.
My pathology is scoliosis, and there are 2 projections that you do with that, and it is the PA and a lateral. First, I'm going to get my patient in, and I am going to do the 2 patient identifiers, which is verify their name and their birthday. Once I have done that, I'm going to get the patient dressed. I'm going to have them remove everything except for their undergarments. We would need the bra off for if it is a female. I'm going to make sure they don't have any jewelry on or any metal anywhere else. I'm going to remove their shoes just to make sure that they're level and they're not uneven, so we can get a full effect of if their spine is curved or not. Once I have the patient changed, I'm going to bring them into my room, and I am going to ask my female if there is any chance of pregnancy and when their last menstrual cycle was. After I'm done with that, I'm going to get I'm going to ask the patient their history. I'm going to ask if they're having any back pain, if there's any complaints, why they're in for the x-rays today. Usually for scoliosis, it is because they had a physical and the doctor suspected some type of scoliosis or some type of curve. Mainly there's usually not any pain or anything, but I want to ask if there's pain, if there was any injury, or if there's any family history of scoliosis. Once I have gotten my history, I'm going to go ahead and start setting my patient up and setting my machine up. First, I'm going to put my SID at 40 inches. I'm going to shield the patient, and I'm actually going to have the patient turn around, and I'm going to have the shield on the back. Usually, if for right now, with these shielding purposes, we only have a lap shield, but normally we would have just a gonad shield to cover because this is going to cover some of the spine. So then we would also have breast shielding for the PA, and we don't have any of those right now, but it just covers the breast to protect the breast from any exposure. Next, I'm going to put a 14 by 17 cassette lengthwise in the bucky, and I am going to put a right marker on the right side, and I'm going to put it in about 2 inches just so I'm going to collimate some, so I don't want it cut off from collimation. Also for this projection, I want to be at the ASIS. I want beyond the ASIS included, so I'm going to center at the ASIS. Which feels like I need just to move it up some. And now I'm just going to have my patient step to the side just for a second so I can line my board up here. And then I'm going to bring them back in. I'm going to make sure that the ASISs are equidistant. Make sure there's no rotation. And then I'm going to collimate in because I'm just looking at the spine here, and we have the spine right in the middle here. And I'm just going to collimate in some because we don't need all of that extra, and we're going to collimate so it's a less exposure to the patient. And then I will take the exposure on or just inspiration. They're just going to hold their breath. But first, before I take the exposure, I need to measure the patient here. And she measures about a 22. The next exposure or next position that we're going to take is a lateral. So I'm going to move her to her side. And before I do this, I will also switch out my cassette. And I'm going to put a left marker now anteriorly. And I'm still going to put it in about 2 inches about 2 inches. Because I'm going to collimate. I'm going to have the same centering about at the ASIS, which is where I'm at right now. I'm going to have the patient put her arms up, grab onto her elbows, just to get her arms out of the way. And I'm just going to center the patient so the center of the light, the collimation, is at her mid-coronal plane. And then I'll have the patient take a deep breath in and just hold it. Just hold their breath, and then I'll, oh my gosh. I will measure the patient first. She measures about a 32, and then I will have the patient take a deep breath in and hold it.